Our guest today is Will Hall, who is a therapist and a researcher, and also a person who knows the mental health problems from within, because as a young person, as a young man, Will was diagnosed with schizophrenia, prescribed antipsychotic drugs, and told he would never recover. A year later, he stopped taking all medication and started his journey of coming back to full health using holistic methods. And this is what we're going to talk about today. Will is also the host of Madness Radio, author of 2 books, a teacher, and a counselor. Thank you for accepting the invitation, Will, and welcome.
Thank you very much for having me. And I also want to congratulate you and express my gratitude for the work that you're doing to educate and contribute to the community there in Poland. So thank you. It's really wonderful to be here.
Thank you. You're very kind. Would you mind if we went back in time to when you were 24 and you started to look for help with mental health? So what was happening that you thought that you needed to see a doctor?
Well, the experiences that I had had since I was a child were never recognized by my parents. They were never really recognized by the school or by the community. I was born in 1966, so this was the 80s, and there wasn't as much of the aggressive marketing and promotion and drugging back then as there was just a few years later when I was in my 20s. And so I was really left alone with a lot of my experiences as a child. And I would have very overwhelming altered states where I would be unable to talk. I would become frozen with fear. I was hearing voices. I would feel very strongly bullied by the voices. I remember being in the schoolyard one day and experiencing, I'm not sure I like the word voice because it's hearing a voice. It's like also experiencing a presence or an entity or some kind of demon or something. And it threw me to the ground and held me to the ground. And no one was really there to support me or try and understand or help me either with medical mental health treatment or even just family support. There was a lot of emotional neglect in my family. I love my family. I don't blame my parents, but both my parents are survivors themselves of severe emotional neglect and abuse. And so I kind of heard about this thing, depression. So I had this understanding that, oh, I'm depressed. And the only way that I knew how to deal with it was just by trying harder. Everything was about me feeling guilty that I wasn't trying hard enough. So I just had to keep pushing, put a front up, put a face up. And at the same time, all this turmoil inside of myself. I didn't even understand what emotions were. I couldn't even name my emotions, very disconnected with my body, very, very lost in terms of my emotional inner world. And then after graduating college, I managed to make it through college. I had a very kind of tumultuous time in school. That's when the pressures really set in to be financially dependent and to have my own career. I was living on my own in San Francisco. Things started to spiral. And all I knew was I had this thing called depression. So I saw an advertisement for the Bay Area Depression Treatment Center. This was in San Francisco. That sounded good to me, get treatment for my depression. One meeting with the therapist, I had an appointment with the doctor. And when I went to the doctor, he gave me free samples of Prozac. And I was put on Prozac. I had one of the most powerful and wonderful coffee experiences. I think anyone, like the best cup of coffee I've ever had, because suddenly all of my fears and all of the weight and the sense of being crushed and overwhelmed and trapped and confined by my inner world just evaporated. And I was just on the moon. I was just flying high. And actually, I had a manic reaction to the Prozac. I lost my first major career job after school. I was working for, after college, I was working for a Bay Area, a prominent environmental nonprofit organization. I lost that job because I was acting so weird. I was acting so weird in my manic state. I don't know if I liked that word manic. And this was a drug reaction, but the drug was combining with my own emotional inner world and triggering this very extreme, very strange behavior, which of course, any drug, what goes up must come down. It wore off, but now I had no job. I had alienated myself from all of my colleagues. I had lost my community because my work and my community were so closely connected. I was now in poverty. And so this spiral accelerated. And when I try and understand people's crisis and that moment that they go into the hospital, I try and understand all the different ingredients, because usually there's multiple ingredients. And when I step back and I think about all the different factors that were going into my spiral, there were maybe 20 or 30. I mean, not eating, not sleeping, being in poverty, being isolated, chemical exposure, previous trauma, being around unsupported people, having no one to talk to. The list just went on and on and on. Food allergies, nutrition, not exercising, being disconnected from nature, unresolved family conflicts. All these things just were pressurizing and pressurizing. And I had been seeing other therapists, and I had started taking meds as an outpatient. And I started to slip into what was later diagnosed as a psychotic state. And of course, now I understand it in a much more complicated way. But I was hearing a very aggressive voice telling me to kill myself. I believed that there was a demon chasing me. I was very threatened by my roommates. I climbed out the window of the apartment. I was to escape my roommates. I wouldn't go through the front door. I was too scared of them seeing me. I would go in and out the window. And I found myself overwhelmed and in this very, very deep state of suffering and altered state. I was dragging my hand, my bloody hand, against a chain link fence. And I walked up to the Golden Gate Bridge because I was going to kill myself. And I picked up some plastic road debris that I felt was this message that I had to give to the cars that were driving by, because this voice had told me to pick up this plastic sign. And I didn't end up killing myself. I feel very grateful to God and to Spirit and my ancestors that I was not one of the people who does jump off of the bridge. But I called my therapist, and my therapist said, well, you need a meds adjustment, go to the clinic. One thing led to another, and I was locked up in San Francisco General Hospital. I was not given any choice. I wanted to go to work the next day. I wanted to work. I didn't want to kill myself. I wanted to go back to work when they told me you have to go to the hospital. I was put in restraints, which was extremely traumatizing. I still have a traumatic association with that memory of the circumstances of those restraints. And I was put into an extremely chaotic, considered one of the better funded public hospitals in the country, San Francisco General Hospital. I was put into Langley Porter Psychiatric Institute, which is a kind of frontline University of California top tier treatment center. And everything that happened to me that I was given by the system just made things much, much worse. I had a lot of problems going in, but now I've got additional trauma from the hospital. And worse, I was given very dangerous, toxic messages like, you're not going to recover ever. You will always need medication. And most pernicious of all, the most toxic, was, you have a thought disorder. Schizophrenia essentially is a broken mental process, which means that you cannot trust your own thinking. If you can't trust your own thinking, how do you work your way out? Well, the answer is you rely on the experts. You do what the doctors say, and that's what I did. I took the medications dutifully and was compliant. I was very bought in. I was completely invested. I thought that I was being offered a solution to this long-term suffering. And again, by the grace of God and circumstance and luck, I'm not one of the people who remained hooked and long-term using the medications. They weren't useful for me. They didn't feel like they were beneficial. And so eventually the insurance money ran out of me being in the hospital. I went from being too unable to take care of myself, too dangerous to myself, too gravely disabled, to suddenly being able to live on my own in a homeless shelter because the insurance ran out, which started to help unravel what essentially is a complete institutional mythology that's built around being a mental patient. It is an aggressive and assertive pseudoscience. It is an institutional belief system that is self-reinforcing, but it's not actually based in science, and it's not actually based in the outcomes. It's not actually truly effective for most people. In fact, it's very harmful for most people. And a lot of what is considered effective isn't effective, because being numbed out on antipsychotic medications, having your emotions pushed down, and being drugged chronically by a psychoactive drug is not really a solution. It's not really healing. It's a way of controlling and dampening and pushing down. And I was very confused because I did see people when I was in the system who seemed to be getting better. Like I was in a residential facility called West Side Lodge, and there were people that would come in. There was this one young man who came in, and he started to get heavier and heavier and heavier. He just gained 30, 40, 50, 60, 70 pounds, like 30 kilos, 25 kilos. And so the staff were saying, oh, well, they made some jokes about he was eating too much, but he was having metabolic failure. He was having a toxic reaction. His system, his blood sugar regulation system, his insulin regulation system was being disrupted by the antipsychotic drugs that he was taking, and very dangerous. He was on the path to diabetes, a young man in his late teens, early 20s. There were also people that came in who were extremely terrified, who were very withdrawn, would not make eye contact, would sit alone in the cafeteria, would not respond when you talked to them, and were visibly cowering. And then they would slowly start to come out of it, and then they would attribute it to the medication. So I also, even though I had negative experiences myself and they were not helpful, the medications were not helpful to me, I also saw this complex reality of medications that in some ways they seem to be helping some people. And so I came out of the system and I started to do my own research. I'm very lucky and very privileged and grateful that my family has always taught me to think for myself and to rely on spiritual resources and to really trust my own inner intuition. I'm a family of artists. My father's a writer, my mother's an actor, and my brother is a sculptor and a musician. I'm kind of the black sheep of the family because I didn't become an artist, at least a professional artist. I became a healer. I went into different kind of work. But I feel very lucky. And there were a number of different things where I was very close to being electroshocked. They had me scheduled for the electroshock treatments, but then it seems that a social worker intervened, and the money running out may have been related to this social worker thinking that I should not be taking electroshock. My father's an electroshock survivor. He reported extreme trauma, memory loss, personality changes, contributing to his PTSD. So I feel very grateful that I did not have that happen to me. And I also feel very grateful that I did not stay on the medications. The way that I came off of the antipsychotics was, first of all, my faith in them was very, very shaken. I was like, what? This doesn't seem to be helping. But I was so scared and I was so overwhelmed that I was just holding on to whatever they would give me. And I got very lucky, in a sense, because I was in an outpatient clinic in the Mission in San Francisco. And the doctor that I saw, he had a ponytail. He was maybe kind of like a hippie alternative doctor. And he didn't talk to me. He just was just looking at my notes, and he was observing me, and he took me off the antipsychotics. And when my prescription would not refill, I went to him and I was very scared. I was like, well, what do you mean? What am I going to do? What am I going to do? He wouldn't answer me. He didn't provide any kind of support. There was no tapering. There was nothing. And I almost died because of that. experience. I spent several weeks in a very severe state, a withdrawal state. It would meet the criteria of psychosis, but it was clearly antipsychotic drug withdrawal. I wouldn't leave the room that I was in. I was living in a homeless shelter. I would barely eat. I would wait until very late at night to go out to the bathroom when no one was around because I was so terrified and so frightened. So coming off the medications, leaving the hospital, feeling like I had trusted them and tried, now I've got to try and figure something out, because I believe that all of us have a survival instinct, and we all have a healing instinct. And sometimes we may not be able to access it rationally. We may not be able to feel it. But if we're put in a circumstance, it will kick in. It'll start to take over, and you'll be the person who just suddenly finds this energy to motivate. And maybe that's what happened. I also feel grateful to my ancestors and to God and to the support that I have had in my life. And I started to really try and think through things more on my own. It took many, many years. I was on a disability check for 15 years. And part of that process was me trying to go back to school and failing to go back to school or going back into the system. And it really was meeting other patients. I had stayed away from other patients. I mean, there's a lot to be said. It's very healthy, I think, to leave all that behind. I tried, and it wasn't for me. I had to go through it. I had to really claim these disavowed, dark, frightening, overwhelming. I had to make friends with this experience that I had. And the only way I found to do it was through other patients. And like I said, I mean, I've seen medications be experienced as useful for some people. I do know that there are people that had positive hospital experiences. But when I discovered the patients movement, and I discovered the survivor activism, and I started to do my own research, I realized what they did not tell me when I was in the hospital. This is a global movement, a human rights movement. It's at the level of the United Nations, international organizations. There's a huge global network of researchers, PhDs, MDs, scientists, faculty, tenured faculty around the world who were aware of experiences like mine, because I wasn't the only one. This happens over and over and over again. It's not that everyone gets abused by psychiatry and everyone gets harmed by medication, but the number of people is unacceptable who do get harmed, who do get abused. If there were any other technology, any other service that had this scale of death and injury and trauma and ineffectiveness, we would question it. But again, because of this institutional mythology and this kind of self-reinforcing institutional loyalty, there has been a refusal by the powers that be and dominant psychiatry and public health, backed by the pharmaceutical industry and the insurance industry and the healthcare industry, to recognize that reality. And yet there is this broader, you could call it the MAD movement, the critical psychiatry movement. MAD in America is a cornerstone hub, I think, for people connecting the ISPS, mind freedom. This movement is out there, and I was able to connect with it. And that's when I really connected with my healing and my recovery. And so since coming off of disability and since changing my life, I've been studying not only how to help people, because I learned very quickly it's not a one-size-fits-all answer. Everyone is very individual. This is probably the fundamental problem with the system that we have, not just maybe our healthcare and psychiatric system is the one-size-fits-all, treating everyone like a cog in a machine or a widget on a conveyor belt, but we have to have an individualized, personal connection with people to find out their specific needs. And then also take the time to talk with people, take the time to meet with people. And I notice
that's Christopher Columbus.
Christopher Columbus, okay, he's very interested in us. Hello, Christopher. Yes, hello.
Sorry about that.
No, it's wonderful.
This movement that you're talking about is really, it started almost 100 years ago. I remember reading a book, I don't remember who wrote it, a psychiatrist, who said that giving medication to patients in psychiatric hospitals is just like putting them in restraints, meaning it's a violence, but not physical. It's a violence in white gloves, he said.
Since the beginning of psychiatry and the asylum system, there's always been people resisting it. That's been part of it. Yeah. That the origins of psychiatry are in population management and control, and the era of the poorhouses, and what do we do with people? How do we clean up the streets? How do we manage these unproductive populations? And so the connection between coercion, violence, and psychiatry has always been there from the very beginning. And it's complicated because I did feel overwhelmed. I did need help. I did need support. I did need a safe place to be. I didn't want to just be left alone. This is why I have a very strong distinction in my own work between a strict libertarian view, which views the problem as individual freedom versus the state. I don't see the equation as individual freedom versus the state. I see the state and individual freedom and the need for support. Those three pieces of the puzzle are the way that I understand it. So it's complicated because I don't want to just denounce the violence and the abusiveness of institutional psychiatry and then be left with neglect. And, oh, we just need to leave people alone. Now, it's true, many people would do much, much better left alone. That for some people, that is simply the solution. And as a counselor, sometimes people come in and they talk with me, and all they need is to hear a different perspective. All they need to hear is that their intuition to not trust the doctor or to not do this or to not is the right one, to back off. That my daughter is hearing voices. She's 14 years old. She's taking magic mushrooms. She's hearing voices. She's having sex with boys. I'm really worried about her. Let me get her into, maybe not. Maybe that's what some 14-year-old girls end up doing. And she just needs you to be, that might be all that the person needs to hear, is just give the person their freedom. Don't allow institutional psychiatry and drugging and diagnosis to come in to the equation. So I learned that there's a complexity. I think that's one of the reasons that the issue is difficult to address, because every time you stand up and say, you know, psychiatry almost killed me, there's going to be someone else in the room who might have some connections to pharmaceutical funding, or might have some connections to doctors who have pharmaceutical funding, or might have, and they're going to stand up and say, no, how dare you say that? Psychiatry saved my life. And then the rest of the society, confused, wanting to do the right thing, and the messages, because we have a relentless drugs and psychiatry are the solution. If you look at memoirs of madness, memoirs of schizophrenia, memoirs of mania and bipolar, and it's almost always it's neglect, salvation through meds and doctors. And that is the story for some people, but I question whether they have been given informed consent about the salvation, or whether they've been given a sense of the alternatives, even as they champion drugs and doctors save my life. Were they authentically supported with access to alternatives and informed consent? But that's not the story for all people. And that's what we're not hearing, is my experience and other people's experience, because we're holding a vision for a better system. And we can talk more about that, because the vision of a better mental health care system is also the vision of a better society. That, I think, is fundamentally
Yes, because we're talking about finding a solution to a problem, to someone who behaves in a way that we do not consider normal or that we do not accept. And we actually, as a society in our Western civilization, we have no time to stop and think. We have no time to take care of other people who are close to us. And what you said so beautifully, your story from the very beginning, when you were a child, you were with parents who were emotionally not available because their parents had been emotionally unavailable, so they did not learn the skill. So when you were a child, you started to feel not safe, not loved, not needed, not important, all the basic values that we need to be healthy as human beings. And then, because you felt that way, you behaved in a different way. So the reaction of your environment again added to your problem. So what you described so beautifully is how a mental health problem actually begins. And an American psychiatrist, Dr. Bertram Karam, said that schizophrenia is a state of chronic fear. And he said, I have never met a patient who had a good life. You don't become mentally ill because you have good life. You have problems with your mental health because in your past, there is something you were not able to deal with. So finding the reason, and he said only through psychotherapy. He even wrote a paper called The Tragedy of Schizophrenia Without Psychotherapy. And so solving the problem I say in quotes, because we in our Western civilization want to have everything quick, and we want to have a ready solution, not to waste time talking to 10 different patients, getting to know their story and getting to know them personally. But we just want to create something that we can give to anyone who comes with a problem and send them back home. It's cheaper, it's easier, it's faster, and it makes some people very rich, actually. But the people who really need help are left alone, and nobody has time for them, and nobody really cares for them. Because I don't believe that giving drugs that numb your emotions or sedate you without helping with any of the core problems that started the mental health decline in the first place, I don't think this is really helpful. This might help for a minute to get you started, but what we really need is we really need to care about other people. We forgot how to love each other.
I mean, I'm on the same wavelength with you. I'm very inclined to agree with Bert. I remember doing a wonderful interview with him for Madness Radio, and I think that the story that, okay, my parents didn't get the love that they needed from their parents, and then they weren't able to provide it to me, and then I had these difficulties that later manifested and got me drawn into, yes, to that story. And I also think that there's more potentially going on. The origins of my parents' trauma, partly family based, but my mother was orphaned as a girl, and her father was estranged from the family, and there's a lot that's not known there, but there are social and historical forces and factors. My father was in the Korean War. He was also in psychiatric hospitals himself, so he carries trauma and violence not just originating from the family, but connected to the family. And so I think that the question of time, it's not just a moral question, do we value time? It's a question, does the society value time? Like, I was thinking about how many people that I work with where the daughter or the son are in some kind of like difficulty, and they're not working, and they don't have a place to be. You know, the parent are living separately, they're away, there's no spare bedroom, the son was at school, he can't be at home alone. What's he going to do with his But what happened to the society of the neighbors or the extended family or the people living in the household who are also not working? Or maybe they're working a few hours doing this, but they're spending most of their time doing so light construction work on the neighbor's place, so that that young person who's in distress can just hang out and just be kind of supported, and just, but in a very kind of lightly held by a community fabric that has time and spaciousness, and often just a physical space like a room, or someone that can kind of
Yeah.
look after. But we're so pressurized by capitalism. We're so pressurized. We live such exploited economic realities that everyone is working. People in the US, they work 60 hours a week. There are no stay-at-home parents. There's no extended families living together. It's a very complicated. So I'm mindful of the way in which locating the problem in the failing of parents or the absence of supportive psychotherapy, that's only part of the picture, because it's much more. People ask me, well, Will, what mental health system would you like to see? And I would like to see, I would like to see the abolition. I don't think we need a mental health system. I think that the existence of the mental health system is itself a symptom of the fact that the community and the society is not taking care of basic needs.
Yeah.
Now, if we look historically and anthropologically, it seems like there always have been people who were sort of designated as specialists with problems. Like there's the shaman that you go to, there's the priest that you go to, there's the person who knows about food, there's the person who knows how to set bones, there's the person who's more nonverbal, who really spends lots of time with animals. There's different kinds of roles that people have based on their talents and based on maybe their inclination and their experience. So saying we don't need a mental health system is not saying we don't need maybe people who are maybe specialized or have certain kinds of, because I would love, if I had sat down with Karen for, 3 hours a week, he would have really probably helped to turn my life around. There's lots of therapists that if I had sat down with them, it would have been worse. In fact, I met them. It's like, it's not just the time, it's also the quality of the time and the skill. Maybe
Yeah.
skill maybe isn't the right word. It's more like the spirit or the heart
Yeah.
of the person. There's certain people that seem to have that. And the other complicating piece is that humans have this very complicated relationship to suffering, because what we're talking about is how do we respond to someone else's suffering. And if you could take someone's suffering away from them, would you really want to do that? Because suffering is actually the very locus of meaning making and developing who you are as a person, and ethical challenge and making a contribution to society. So much creativity and moral commitment and identity and profession and vocation come out of suffering and our struggle with suffering. We have this marvelous existential philosophy tradition that puts the suffering of meaningless at the very center of a vast, and grappling with the meaning of life and why am I suffering? I mean, my goodness, that's the supreme spiritual. Why would we want to take this away from? So it starts to be very complicated, because I can look at my experience and I could say, I never should have gone to the hospital. I wish my parents had been, healthier and had support that they needed. I wish I mourn for that loss. I absolutely mourn for that loss in my life. But at the same moment, I have to embrace it because of what it's given me. A lot of people who have chronic illnesses or are diagnosed with a terminal illness, if you talk with them, they will say, this is the best thing that ever happened to me, which is unthinkable. I would never say to someone, oh, congratulations, you have a cancer diagnosis. But it's undeniable that the adversity that we face as humans is what makes us. So we have to have a conversation. This is why I named my book Outside Mental Health. I don't think we need to replace the mental health system with a better system. I think we need to step back from the entire understanding of what mental health is, and recognize that fundamentally a mythologically based institution driven by power and profit has colonized human experience. Psychiatry is a continuation of colonialism. It's a market expansion, and we are the natural resource. psychosis is a natural resource that's harvested. We're mined in order to become part of this economy. So many people have made so much money off of my madness. There's been so much billing that they wouldn't be able to do if I didn't give them the natural resource, just as if they were digging coal out of a mine. And that's fundamentally, we have to rethink that logic, because that's the logic of the modern world. That's fundamentally the crisis that we're facing. And I published an essay years ago because I have vowed to myself to no longer offer like the better treatment or the new approach or the simple policy change. If we just have Hearing Voices Network groups in every community, if we just have open dialogue, well, actually, that's kind of a false promise. I'm very strongly supportive of the Hearing Voices movement. I'm trained in open dialogue. I use my learning from it. I'm very informed by Soteria House, but that's a false promise if we think that we can actually make those alternatives work in a for-profit healthcare system that dominates the globe. It exports it to Poland. We have a global empire that is putting so much money into arms escalation and military and taking those resources away. We have a failed political systems that are really denying people democracy. The idea that we're going to somehow promote open dialogue and it's not going to be co-opted and twisted. I'm already seeing the phrase open dialogue used in practices that I would really question. And it's predictable. It's predictable. So I wrote an essay about thinking upstream. We have to go as far upstream as we can. And I really appreciate what you said about naming love, because if we go far enough upstream, it really is a failure of humans to take the time to love and forgive and connect with each other. And that is it's an ethical imperative, it's a spiritual imperative, it's a social imperative, but it also has institutional resources that we can put behind it. We can start to build into our society spaces where that caring will emerge. I'm interested, I know that it can be twisted, but I'm interested in the idea of universal basic income, because we have a line between the disabled and the non-disabled, and everyone is running around 60-hour a week plus the gig economy, scrambling, hustling up. And if you actually just give people some freedom from that, it turns out that humans start to connect with each other. We've forgotten. I mean, the internet, if you look at the internet, I mean, there's many dark aspects of the internet. The internet is an incredible outpouring of generosity, and it's being twisted. I mean, you spend hours writing advice for Reddit, or you post a YouTube video about how to repair something. It gets grabbed and manipulated and turned into advertising and monetized. But there's this incredible outpouring of mutual aid and generosity and just people taking care of each other outside of a commodity, profit, domination, exploitation nexus. That is what we have to tap into if we're really going to solve the mental health crisis. So I also want to add that the story of, okay, my parents were mistreated by their parents or neglected, and that ended up on me. It's a plausible story. What's significant is not that we create a new diagnosis so that I know this model of madness is failed. Now I'm going to give you a new model of madness. No, I think that fundamentally the shift starts to become about how we create knowledge about ourselves through dialogue, and we allow people to have self-determination of their knowledge. Someone comes into my counseling session and they say, Will, why do you, okay, so it's not a gene that's causing my schizophrenic break. It's not, a chemical imbalance of dopamine that's causing my schizophrenic break. It's not even schizophrenia, and maybe it's not even a break. What was it, Will? And my answer is not going to be, you're a shaman, or gosh, you have gluten intolerance, or it's also not going to be, you're a trauma survivor and all these symptoms that are called psychosis are just dissociative. And that's not, I'm familiar with those frameworks, but my answer is going to be, let's explore it together. Let's open up some doors, some possibilities, because I want to help you to make meaning of your life. And I'm going to help you I'm very influenced by pragmatism and skepticism and William James, who fundamentally saw knowledge and saw spiritual belief not from, is it true, like can we observe it in a microscope, although obviously you can make observations of certain things under a microscope, but is it useful for you? So if someone comes in and they say, well, I hear voices, I take medications, it suppresses my voices, it allows me to work, that's great, that's useful for you, as long as you have some information about informed consent, because they may not want to talk about their voices, they may have something else. I'm remembering a story I often tell about a support group, that because I've done a lot of work with support groups, and there was a woman who came in and she was cutting. She had visible cuts on her arms. They were often fresh cuts and they were sort of semi-bandaged. It was very hard to see this, because we imagined it was very painful for her, but she wouldn't talk, which was fine. In our groups, we don't put people on the spot. We don't come in. She kept coming. She would come back to the group. We'd allow her to come back to the group. So we had trust that there's something happening here. She's coming back. And then finally, she would start to talk. And she did have an issue that she wanted help with. It wasn't her cutting. It was her abusive boyfriend. That's what in the cutting, actually, when she started to tell us about it, it was actually helping her, because it helped her to know that her pain was real, because her boyfriend was denying her pain and she was so under his spell. So you see, the story is it's a capsule of how we have to be very cautious about what it is that we're offering people. Are we offering them our expertise because we're going to interpret? People love it when you give them answers. They love it when you play the expert. They love it when you dominate them. They love it when you control them. They love it when you just exploit them, because they're familiar with those things. They obviously don't love those things, but they seek them because they can be comforting. They can be familiar. They can be relieving. Will, just tell me, how should I come off my meds? The new method says you do it like this. Well, maybe that's the way to do it, but maybe gradually, I'm gonna go out on a limb here. Gradually coming off antipsychotic is not for everyone. If you have neuroleptic malignant syndrome or you have tardive dyskinesia, you might want to come off your meds faster. That's your choice. That's your choice. I'm not going to sit here and tell people that I can X-ray their brain physiology, much less their soul or their karma, to know how to make a good life. And so I work with people who are on meds and they stay on meds, and that's what they want to do. And I help them to understand that there are maybe choices and options, but a lot of times people have tried those choices and options. And as long as they're informed and they understand, which is an ongoing process, then my job is to connect with them as a human being, not as someone who I think I know better than. And that, I believe that it creates a kind of communion. It creates a kind of community. It creates something very different than the exploitive control, domination, profit, property thing that we have. And there's very few pockets of that left. And I'm not idealizing therapy, because therapy is itself a commodity. It's a very complicated conversation about what is therapy, how to approach therapy. But I think fundamentally it's about connection. People ask me, what if you don't believe in biologically, although sometimes it is biologically caused. I mean, sleep deprive yourself for long enough, it's going to change your brain chemistry, boom, you're going to have a psychosis. But people say to me, like, hey, Will, what is it that's the issue? And it seems for a lot of people to come down to isolation and empowerment in the broadest understanding, how to connect with other people around and how to have some sense of control or agency, even by meaning making. I've been recently reminded that Viktor Frankl is not the angelic character, but that sometimes we think of him, and he maybe doesn't represent himself accurately. But Viktor Frankl, at least as the myth, man's search for meaning, it's a very beautiful story, parable almost, of how even in a situation where you have no control, you seemingly have no control, you can still find some empowerment even by simple, small choices about meaning and how you want to. So it seems like maybe what I'm doing when I work with people and in groups is helping people to find connection and helping them to find some kind of empowerment, which can look like many, many different things. So
I also think even if you had a set of sentences that should be said to a patient, and they were approved by the FDA and other institutions. It's
Right.
not about the the knowledge that you get from someone else, but it's what comes from your heart. When the other person feels that you really care and that you really want to help them, they can feel it, and it opens up all of those emotions that they were holding back, being scared to look at them. Because being alone with your scariest thoughts and feelings is terrifying. So having
It,
someone
mhm.
just to feel that there is someone who feels for me, this may
it,
do
it,
a lot.
it can. It can. I mean, connection is a really interesting thing because you can connect with yourself. You can find a sense of dialogue and a sense of communion and relatedness. And you can also, I mean, there were times when I just had to withdraw. I was the roommate who stayed in their room all the time and no one ever heard. And he was weird. And eventually they kicked him out. I was that guy. But that may have been what I needed as my way of finding a way of relating to the, you know, the open dialogue folks we talk about is like losing a grip on life. And there's a lot of ambiguity there because who defines what life is and what does it mean to have a grip? But
Yeah.
getting someone to have some sense of agency or some sense of being able to have some place that they can be. But fundamentally, I think it's a conversation, and you have to bring a certain kind of humility because sometimes people want, hey, I'm here to listen, and sometimes people want, tell me what to do, and I'll say, okay, well, since this could be helpful, I will frame it. I'll put a qualifier, but yeah, I'll help. I'll make a list of suggestions. That's what's really going to be helpful to person. You know, sometimes, especially with addictions, it seems like some people really need a stern, strong, do this, don't do this, to hold on
Yeah.
to something very firm. And if I come in with like hey, let's have a dialogue, I don't know what's going to help you, you see? So one of the tragedies, I think, with the way that the system is set up is that we don't trust people to form relationships with a counselor that is going to be right for them or a community that's going to be right for them. And then when people do find that connection, sometimes the person they'll leave the group practice, and the rules of the group practice are you don't take your patients with you. And then suddenly so there's
Yeah.
so many ways that I think we fail institutionally to have the kind of flexibility that's really, some people a woman may not want to work with a man, trans people may want to work with a trans therapist, or they may not want that to be the issue at all. They don't want being trans. That's not why they're there. They don't care. They don't need a trans therapist. They need somebody to help them with something completely different.
Yeah.
So the flexibility and the individuality is
Yeah.
really what's often missing. We come back to there's the factory farming. Psychiatry really is a factory farming model. You're basically cattle moving through
Yeah.
through a feedlot, basically. And
So
there's
we
that.
need to go back to organic farming with a little tiny community living together, knowing each other and
Yeah,
helping each other. Because when you live in a community, you know you can rely on other people. Because when your roof is leaking, somebody will help you. And then when you see somebody else in trouble, it's obvious you will go and help them.
I would
So it
hope
would,
so.
yeah,
I would hope so. But
yeah,
I think what's needed is mysterious because we could romanticize the past. And I've traveled enough and I've been around, some traditional cultures that were very, very structured and people are taking care of each other. But oh my goodness, patriarchy, control, rigidity, lack of freedom, narrow-mindedness. I mean, there's a lot to be said for the changes and the modern new creating something different. I don't think we should just we have a lot to learn from traditional cultures and from indigenous cultures and from cultures that are being colonized and have been lost and destroyed and damaged. But we also have to meet the challenge of creating something new because we don't want to romanticize those kinds of scenarios because there may not be it for everybody, and those all humans and all cultures and all societies have dark sides. So
Yeah, the problem here is that when we get to know them, they change. They change under our influence, under the influence of alcohol, sugar, and other things, coffee, that they have never tasted. So the moment we meet them and we judge them, they're already different. They're not what they used to be.
Hmm.
And what they used to be, we will never know because they used to be that before we met them. And we
That
kind
is
of,
true. Yeah.
yeah.
Yeah,
But
it's a
I would like to
complicated
go back.
conversation about the
It is
indigenous. I mean,
it's complicated.
we use that kind of indigenous reference in kind of like a colonial way. We kind of say,
Yeah,
well, that's the good and then we're the bad. And it's a complicated story, but I absolutely I have learned from indigenous cultures and some of my own ancestry. And I think it's really important to
yeah,
some of the basic questions have been solved by cultures that are now under attack. And we're not listening to the solutions that they have
yeah,
because we are obsessed with our profit and our technology.
yeah. Your forefathers came from the Choctaw tribe,
Yeah, I have ancestry in Choctaw Indians. Yeah, my mom grew up in
and
Oklahoma.
yeah, and the trauma is being transferred from one generation to another. And I always say that there must be someone who will be the first to change it because
Mm,
trauma, like in Poland, we were traumatized for generations because of the war.
yeah, yeah.
So, like, I cannot imagine my mom being carefree and happy and able to cope because she grew up as a child of war.
Mm,
So my grandmother had to run away from people chasing her, taking her children,
mm,
small children, and running away somewhere to hide. So I always say that the trauma is being transferred from generation to generation, but the real nature of human beings on earth is healing.
mm,
So there will be someone who breaks the cycle. And there will be one person that will be the first in the long generation of people being traumatized with wars and other things. And the person who is the first will have enough inner power to change, like yourself, and start a new line, a new way of thinking, because you have healed your emotions and you have healed. I just wanted to go back to the time when you left the hospital and you had to do something with your life. What did you do that helped you heal
mm.
and become a therapist?
Yeah, it's a huge question. It's a question I get asked a lot. And again, there's that what's the solution or what's the magic ingredient or what's the thing? What's the way out, Will?
I
People
imagine
often.
there is no magic ingredient,
Well,
but there
yeah, I
are
mean,
probably many small, healthy steps that you
yeah,
took.
yeah. I mean, I think there's a lot to be said for the idea of grace and luck. And maybe there's something to be said about trusting and faith that something might change and something might become different. I mean, I have certain kind of privileges that I grew up with that I certainly leaned on that other people may not have. And I feel very grateful and very lucky having those privileges. I also, there didn't used to be a Social Security Administration in the United States. There were no disability payments. This is the labor movement. It wasn't just the labor movement. It was like the labor movement backed up by revolutionaries all over the world that were threatening. Frank Roosevelt introduced the New Deal not just because he was, sitting around thinking, wouldn't this be a great idea? He was pressured because they were afraid that they were going to
Yeah.
burn down the whole capitalist order. And so I'm very grateful to the different kinds of support that I had. The disability system has been underfunded, but I did get a disability check. I was getting subsidized housing. And the reason I say this is because I had some time. I had a little bit of time. I could
Mm.
give myself years. And in that, I was able to, again, it's not a perfect system, but I was able to work part time that was helpful. Part of me resists the idea that, work is rehabilitative because it sounds like giving credit to capitalism as being positive, but it is. I mean, having a place to show up and having a little bit of financial independence. I got very lucky. I worked in a wonderful independent bookstore in Northampton, Massachusetts, and they became like my kind of little family there. They were accepting.
Mm-hmm.
I had been kicked out of another job at another bookstore across the street. So it was very satisfying to me. After being kicked out of one bookstore, I got hired in another one. And then I would sometimes see the owner from the old bookstore come through, and he saw that I was sticking around. Obviously, it wasn't me that was the problem that I got kicked out of this other. It might have been a problem with him or the store. But I keep coming back to those little things that gave me a sense of agency and empowerment and control in my life. And then the connections that I was able to make. So empowerment and connection. And the turnaround was when I got involved with the patients movement, when we founded Freedom Center in Northampton. And it wasn't that, well, we had this special program or there was this special thing that happened in support group. We were using this amazing technique from the Hearing Voices. It was just that people found each other and they could become friends. And I had some friendships that went horribly wrong. I'm not idealizing friendship, but coming out of the isolation, being able to just hang out with people. And there's a less of a feeling of hiding. There's more of a feeling of camaraderie. We can share very intense experiences. When someone says they want to kill their psychiatrist, everyone just laughs because we've all had that feeling. We all know we're not going to do it, but it's a real feeling. We want to get it out into the open, or feeling suicidal, or feeling like really, really angry at how pharma is doing this, or the moms and the fathers are taking over the mental health movement and NAMI, and just having a space where we could really, oppressed groups of people congregate to validate each other's experience. So those are two really big ingredients, starting to have a little bit of control. And then the trauma framework was really important to me, understanding that everything I was going through wasn't just like thought disorder, broken brain, genetics, but wow, dissociative symptoms explain a lot. Starting to really embrace my spirituality, that when someone leaves their body, someone dissociates, disconnects, you're connecting to something. You're leaving your body, you're going somewhere else. And that maybe a spiritual framework can maybe understanding the idea. And we use the phrase ancestral healing, and it can be quite kind of mystifying and very kind of California, but it just means understanding your family history and who were the kind of standout characters and what did they go through, and what were maybe some of their unmet needs. You mentioned about hiding and being under attack and being not free. Well, those are weights that our parents and their parents and our relatives felt that we also feel. And so the idea that if I'm working on my own courage to speak up and not get exiled or driven out or ethnic cleansing or whatever it is, if I'm working on that obstacle or that challenge, I'm doing it surrounded by my ancestors who are just rooting for me, who are just on my side. We're doing it for all. It's for all of us that we're doing this healing together. I think, connecting with nature and believing, like you said, that healing is a natural thing, that there's a process that is just happening within us, that really starting to see that and believe it, spending a lot of time with nature. There's so many different things. I very strongly believe that anyone who has any kind of mental health distress will maybe benefit from exploring nutrition, looking at food allergies, looking at chemical exposures in food, also the environment, looking at those kinds of stresses that can contribute. So maybe there is wellness practices. I learned to be very, very careful about my sleep, that understanding those connections. And it sounds like, oh, you eat food, you sleep, you exercise. These sound like really simple. When you're 22, you're not connecting any of those dots. You have the idea that food and sleep and exercise mean anything. It's just because your father told you or your mom said, and she's wagging her finger. And you have to separate out that rebellious, do it because mom and dad, I don't want to do it, from finding your own, like, oh, these are dots I want to connect because they connect to my goals. So slowly, because I really had no, I mean, again, I love my parents, I'm not blaming them, but I didn't know how to take care of myself. I didn't know how to connect feelings. I didn't know how to have a conversation about feelings. It was a very slow process. So I feel like I was on disability too long. I feel like if I had certain kinds of support, the turning point, it actually was a therapist who helped me. I was afraid that if I went off disability, which is a very hard thing to do, it's a whole other conversation in the US, getting off of disability. Just from a bureaucratic standpoint, it's a very hard thing to do. But I was afraid I wasn't going to have money. Obvious, like you got a $700 a month. I mean, it's so little money, but I was afraid of letting go of that because it's $700 a month is like everything when you're living in poverty, because I've lived in poverty most of my life. I was afraid. And so I was afraid I wasn't going to have money. And then a therapist helped me to really go deeper into that fear. And this is one of the things I think is really instructive, that we run away from our emotions. If we can move towards them, sometimes they have messages, they have meaning for us. And so this therapist helped me to go into my fears. And I learned that it wasn't really that I was afraid of not having money. It was that I was afraid of being alone and not having money. That I would not have money and I would have nobody to help me. I have nobody. And then I just took an inventory of my life. Back in the day, I really didn't have anybody. But now I took an inventory. Actually, I have people that push came to shove, I would sleep on their couch. They would help. I could raid their refrigerator. I realized that and so that helped me to overcome the fear of coming off of disability. So there's so many different ingredients. And, when I meet people, I encourage them to look at the habits of framing things, like how are we thinking about things, the negative self-talk. What's that?
Subconsciousness. Like,
yes, being aware of what you're bullying.
Actually, I've written a few books about that because that's my specialty.
Oh,
I have discovered that myself when I was 16, like how your mind is constructing certain thoughts based on previous experiences.
Automatically, the habits that
automatically. And then when you grow up, you're an adult, but still those previously learned beliefs and thought constructs are still controlling the way you think, the way you react, and the way you live.
I don't deserve better. If I try, I will fail. If I show myself, people won't like me. These kinds of, absolutely. And meditation has been really important for me. I'm cautious about getting on the meditations for everyone bandwagon, because meditation can be a great way of suppressing and controlling and numbing yourself as well. But often it is, I think, used in a positive way, you become aware of those self habits and you get aware of the assumptions that are operating, and then maybe you have some more freedom to kind of try things differently, and explore things, and maybe make the jump to move out of that apartment or come off of disability, or leave your job, or break up with that boyfriend who's maybe not the best for you, or reconcile with your parents, or cut your parents off. Or I spent a lot of time not talking to my parents, many years, where they were not, and it's painful, and I mourn that loss of that connection with them. I wish it had been less time. I wish maybe I'd had a good family therapist, or I don't know, just if I just, instead of spending 7 years not talking to my mom, maybe 2 years not talking to my mom. But I have to say, I'm glad I did it. That was some really toxic, messed up stuff that I was stuck in with my family. And so that it's hard for family members to hear, but sometimes you have to accept the distance, and you've got to realize that trying to help is actually not helping. You're bringing in the family dynamics, and the person needs to be separate from you, even if they screw up their lives and make bad mistakes and go down even further, because that's the process. They have to go through their own independence, because the fundamental thing is they got to figure it out for themselves. Mom or dad can't just be making the decisions for them. So there's it's interesting to think about all the different ingredients, if there was one thing that I would want people to pay attention to, it's sleep. That's the one thing, because I see that as being so common. And people say, well, I had a bipolar episode and I was, okay, but what exactly was going on in that bipolar episode? Well, I started to think that I was the Buddha and I was working on this novel and I started to, well, actually, wasn't interested in sleep. Aha. So at first, when you were sleeping, the mania was at, so-called mania was at 10%. When you stop sleeping, now it's 60, 80, 100, 150%. Yeah. If we could just teach people to interrupt sleep deprivation, we could dramatically change the whole picture of mental health and psychosis and so-called bipolar. If we could just focus, not lithium for life. Lithium creates manic episodes. It'll stabilize you, so-called, but it'll kill you. It's a very toxic drug. And a lot of times when people are coming off of lithium, they're dealing with the original conflicts or the circumstance that was driving that crisis. But now they're dealing with lithium withdrawal itself, creating manic episodes or long-term exposure to lithium, increasing the susceptibility to manic. So if we could just be more evidence-based and more scientific and more rational about sleep deprivation, and we could just be, so that's the first thing, sleep. And the second thing is, if we could just understand these are drugs, these are not treatments. The branding Zyprexa as an antipsychotic was a brilliant marketing move. Zyprexa will knock anybody out. It'll tranquilize. I mean, the antipsychotics are used in veterinarian medicine. They're used in wildlife management. They're used in zoos, not because they're psychotic gazelle and psychotic Bengal tigers, although that's an interesting conversation, but just to sedate and control these animals. Although it turns out that animals will start to exhibit so-called mental illness because of things like stress, confinement, neglect. So sleep and seeing drugs as drugs, including psychedelics. That's the basic problem with our conversation about psychedelic medicine today, is we're not realizing that psychedelics get you high. They're drugs, they get you high. So we need to understand them that way.
But they do not cure anything. They're just like another phase of looking for something that will solve the problem quickly, without us working and diving too deep into the psyche, into the emotions, into healing the soul and the mind, but just to be able to give someone an easy and affordable solution so that he can walk away and we can
but I want to be
take care of another patient.
I want to be cautious about creating too much of a value judgment, because sometimes you just want to be tranquilized. Sometimes you do want to be that Bengal tiger who's been hit with Haldol and just can finally sleep and not be gnawing its own arm because of the pain that it's. The tigers have arms like paw, I guess is what I'm trying to say, or going too deep. Like, it's for those, I mean, sometimes you just need to be on the surface. You need to stay away from depth. Depth psychology is not the answer for everyone. I think that we often go in with our agendas as helpers and as healers. And it's sometimes that's one of the reasons I really appreciate the training I did in process work, because it's a training in counseling, but it's very closely connected to a training also in mediation and conflict resolution, and also in coaching. That the tools that we use in process work, which is it's kind of a Jungian psychology combined with Gestalt and systems. So the tools that we use are applied in multiple realms. So mediation, because so many of people's emotional distress situations or even psychosis is about conflict. And so much of the time that people need is not, how are you feeling today? But, okay, let's sit down and work on that resume. And so I do my best to kind of be able to switch in those different registers, because sometimes people just need a coach. And if you're there wanting to work on I love working on dreams, but it may not be what the person wants to do. They literally might just need problem solving and making a list of how the hell they get out of their terrible roommate situation, or how they can, figure out some concrete steps that they can do from like a coaching standpoint.
So you're a world-known expert on tapering because when you left the hospital and you stopped taking all the psychiatric drugs, you didn't know you would have terrible withdrawal effects, and you had to deal with that. So you had to find a way to live through the withdrawal and also work out a way to stay off the drugs. So,
well, I'm not sure I would frame
how
it
should we?
that way, but yeah.
Yeah, well,
But go ahead, yeah.
okay, thank you. um, my question is, what's the best way to come off the drugs? I know there is no equal way for everyone, but perhaps there is someone that you can tell as an instruction guide for beginners.
Yeah, well, I did. I wrote a guide, the harm reduction guide to coming off of psychiatric drugs.
So
And
we're going to translate it into Polish, but until we
fantastic,
do, please.
fantastic. Well, there would be kind of a narrative which says like, well, I've been through it. I learned the hard way. Let me tell you how I did it. Now I'm an expert because I did it. For me, coming off of antipsychotic was just dropping me in a river, and I just went down the river. I just banged my head and I went down the rapids, and I had no control or agency. There's nothing. So that was a cold turkey experience. That was an abrupt withdrawal experience. I wish that I could sit here and say no one should ever come off of psychiatric drugs cold turkey, but that's never been my position. Now, there are some drugs, benzodiazepines especially, are extremely dangerous if you come off abruptly. They can cause seizures, for example. You can have, in certain situations, you could even have a heart attack from abrupt withdrawal. So abrupt withdrawal, extremely risky, especially for the benzos. But I'm not really, to be honest, I'm not even in a position to say gradual withdrawal is always best. Never come, because first of all, there are indications that clinical psychiatry recognizes for abrupt withdrawal. Like if you're taking lamotrigine, and you get a rash, that's life-threatening. You could die within hours. Stop taking the lamotrigine cold turkey. Stop it immediately. Are you're going to have withdrawal effects from the lamotrigine? Well, you might. But again, the withdrawal effects have to be balanced against. So this idea of balancing pros and cons, that's why I think a harm reduction approach is most useful. I'm not going to say that it's right for everybody. Some people just one way, the only way, abstinence. Okay, I get that. But it seems that you have to kind of recognize the potential harms in the situation. One harm is staying on the drug for longer, even at a lower dose. That's a harm. You're continuing to be exposed. We don't know. I don't think it's a linear process. I mean, maybe it's like one day you don't have tardive dyskinesia and the next day you do. I mean, could be a nonlinear disease process from exposure to antipsychotics. So the harm from being on, the harm from going off too quickly, and some of it is withdrawal discomfort, but also you can have prolonged withdrawal syndrome. You could create problems for yourself that are long-term from the way you withdraw. But then there are also the harms from, wait a second, I can't work. I got to stay on. I can't take time off of my job to withdraw. So there's the harm from treatment. Like, oh, okay, if I come off this drug, it doesn't go well, boom, I'm going to be back in the hospital. That's going to be further. There's the harm from the reemergence of whatever kind of emotional distress that perhaps is being suppressed by the drug, such as a so-called psychotic episode or suicidal feelings. So if this was simple, then I think we would have solved the problem a long time ago, but it's complicated. So in general, what I see is that people do tend to come off too quickly. So I would lean towards exploring coming off more slowly. That is the biggest message, but it's not a one-size-fits-all message.
What do you mean by slowly? How slowly?
Well, I think it depends on the drug, and I think it depends on how long you've been on the drug. And the doctors will sometimes say, well, I'm not going to take you off immediately. I'm going to do it the right way. I'm going to taper you. We're going to come off over 2 weeks. It's still a very rapid withdrawal. There's a lot of discussion in forums, a lot of discussion, different people's perspectives. There's a very important research that's come out about the hyperbolic tapering, that at the early phase of the tapering process, you can come off more quickly with less withdrawal because of the way in which your body is metabolizing and adjusting to the exposure. Whereas at the lower end, you have much higher withdrawal effects and risk of what's called relapse or reemergence of crisis from very small adjustments. And I see that tends to be borne out, the withdrawal. But a lot of people, they want to come off the drug. And so the severity of the withdrawal effect is not the only factor in their decision making. And I have to be in a position of helping inform them about that. What I think is most important is addressing your fear. And fear happens when we have lack of information, when we're in the unknown, and we have lack of control. So starting to put together a life plan, that I think that it's a mistake, and this we learn from addiction science, it's a mistake to think of the drug in your brain. You have to look at the drug in your brain and your life. And if you are surrounded by people who, I have all these supportive people. My wife is really supportive. My parents are really supportive. My coworkers know my situation. They're very supportive. They love me. They love me. They're very supportive. How do they feel about you coming off of medications? Oh no, they don't. They don't want me to come off. So people, they don't understand that you may need to do some work to develop a life context that actually really is supportive. That's someone you can disclose, that you can lower the fear. You may take a lot of times with the withdrawal process, if I meet with someone, I'm not working with them on dose reduction right away. We might work on meeting with the wife and say, let's hear about her legitimate concerns about, look, you're going to come off again. This is the fourth time you've done this. It wrecks my life. I have to bail you out of the hospital. I'm left with dealing with life, and dealing with some of those issues first can make a real dramatic difference. Having some handle on a sense of control and a sense of fear and the unknown through dealing with supports can really make a difference, more perhaps than the pharmacological impact of someone's dosage on the brain. So the support that you're surrounded, the availability of tools for coping with withdrawal. And like I said, the number one, people say, oh yeah, I know how to get to sleep. Well, what do you do to get to sleep? Well, I drink some chamomile tea. Okay, what else? What do you do if the chamomile tea works? Doesn't work. You need to have 10 things that you can do to help you, because it will make a difference between going back in the hospital or going back up on the dosage. So working with people to try out those withdrawal coping strategies before they start the process, so they have things they can rely on. And then you see we're having less unknown. It's more like, I don't know what I'm going to do. It's like, oh, I know what I'm going to do. If I can't sleep, I have 10 things I'm going to do. You have more control. Oh, well, I know that if I call this person, they're going to tell me to go to the hospital. So I know, don't call this person. A lot of times people have to step away from their family, because I'll ask them, well, what happened the last 4 times you tried to come off? Well, I ended up in the hospital. No one ends up in the hospital. The hospital isn't this sort of like, strange storm front that just moves in and starts hitting you with lightning. There's a process. And sometimes people will say that, oh, it's always my mom, always not to demonize the mom, but it's whoever it is, it's my husband or whoever it is, they're the ones that call. Like, well, why? Well, because they got afraid. Well, let's talk about that. Like, what was really good? Were you burning down the apartment? Well, actually, it turns out that they probably could have tolerated without calling, but there has to be a conversation to say, I'm going to try and come off. It's going to get rough. I may not go to work for a few days. If I act weird, if I act paranoid, here's the plan. The step 1 is not call the police or call the hospital. Step 1 is all these different, step 10 is maybe once we've tried all these other things, people can have an advanced directive. I agree that under this circumstance and that circumstance, yes, call the police. I've taken my clothes off and I'm walking down the street, which is not just a stereotype, it does happen. That's when I don't, no matter how happy and connected with the Virgin Mary I am, call the police and get me back, get me out, get me into the hospital. And under these circumstances, I can't sleep, I'm grouchy, I'm paranoid, I'm anxious, I'm talking about killing myself. Don't put me in the hospital. That's my choice. So all these things help people to lower their fear by having a sense of control, and they face some of the unknowns. I'll say, well, what happens if this? I don't know. Well, let's look at that. Okay, now we have a plan to deal with that. Going back up on the drug doesn't always work, but often it does. Knowing what the risks are, I'm going to tell the person, like, there's a chance that this could happen or that could happen. It's not super common. If you go on the forums, the withdrawal support forums, you will find a considerable number of people that have had this really negative outcome. But keep in mind that a lot of people that have not had that outcome aren't on the forums. They're out there. So it's very difficult to make these decisions based on the unknown. We don't want to just focus on the worst case scenario, because now we're feeding the fuel of the fear, and we're creating a false sense of control. If I do it the right way, then I won't. That's one of the great tragedies and crimes, really, of these drugs, is that doctors are not willing to say, yeah, you're a guinea pig. That list of side effects that's on the inserts for the drug, guess where that came from? Not from testing. That came from marketing the drug in the world, and then people started reporting the side. We had no idea that some of these, well, they didn't look for the side effects. They didn't actually do the testing properly, but these are very dangerous, risky drugs. That's the situation that you're in. Facing that, and often it's facing the enormity of it. It's a terrifying thing. So helping people to look at that fear, to face that fear, and to put some sense of control and unknown. And then also saying that, look, people do come off these drugs. They do. There's lots of people that have come off of these drugs. There's many, many people. We don't hear those stories. The media is saturated with stay on drugs saved my life stories. The people who've been on the drugs and come off of them, they have multiple reasons not to tell their story. Being around, hey, I was diagnosed bipolar, I don't take, people vilify you. They see you as carrying we do the same thing around the anti-vax. It's a very interesting social dynamic of scapegoating and seeing someone as threatening to our safety. Therefore, we have to shut them down. So people who have come off of antipsychotics or even antidepressants or benzos, we don't hear those stories as much as we should, but they're out there. So showing people the positive, and then people recognize that it's a big deal. It's a life passage. But I just say, hey, and I sincerely believe this, if you want to stay on these drugs, I support you 100%. And if you want to try and come off, I support you 100%. My job is to support you, not doing it right, not doing it perfectly, not succeeding, whatever that means. I support you. Sometimes people will go down on the drug and it's really hard to come off. And then maybe that's the right choice, is to stay on. Let's celebrate that you reduced your dosage 80%. You're at much, and let's inventory all the improvements. I feel so much more alive. My head is clearer. Yeah, I'm on this damn stelzine. I don't want to be on, but I'm on a much lower, because that is one of the tragedies of these drugs. It appears lithium, especially also the antipsychotics, maybe the benzos, maybe the antidepressants, very hard to come off completely for some people. Maybe they end up staying on long term. There's lots of big chemical changes in the body and brain. I believe that the brain and body can heal. I never tell people anything is permanent. I tell people that there may be very low likelihood, or it's very unusual, but I will never say anything is permanent, because I think that we know, and it's not just a spiritual California thing, but we know that your beliefs, not your chosen beliefs, but your deep-seated beliefs, have a huge effect on the outcomes. There was research that just came out about, there was an incredible study done about the genetic hereditary risk for a certain illness, and they compared the actual genetic hereditary risk for a certain illness. They compared it with the increased risk from telling the patient about the risk. And it turned out that telling the patient planted the seed more than the actual.
Yeah.
So the
Oh,
placebo
yeah.
effect or the nocebo effect. So I'm constantly
Yeah.
trying to create this. I 100% believe, and I really do believe that people can improve their life. I absolutely believe they can. And I believe that I'm committed and I'm going to help them. And if it's not me, maybe I'll help them find somebody else if I'm not the right person for them. But I 100% believe that they can improve their life. What that looks like, reducing, coming off, making this change, making that change, we'll find out together. But the fact that I believe 100%, it helps them to believe 100% in their bones, because our bodies are healing. We're part of nature. Nature is doing two things. It's surviving through healing, and it is becoming more and more expressive of its uniqueness. That's what nature does. That's what we do. So your healing process is always, often it's just about getting out of the way of that healing process. But I bring that positive belief. I hope that the harm reduction guide conveys that positive belief, even as we face some of these very difficult realities that people are in. And then I often I'm asking people, trust your intuition. Oh, the doctor added a tramadol, but I don't think it's helping. Or the doctor added Wellbutrin. I don't think it's helping. Trazodone. I don't think it's helping. Then maybe that's the first one to start coming off of. I don't think I need this drug. Your intuition actually is not just a guess. It actually is your body trying to tell you things. We do this all the time with hunger. Our body just tells us, now's the time to eat. This is what I want. This is what I don't. A lot of us are disconnected with our hunger, but we have these signals from our bodies that have tremendous wisdom. And I think that that's at work in the, I'm not just going to say be devoted to your intuition like a guru and a disciple. I mean, inquire, look, do the pros and cons, but ultimately it is going to be your choice, which is always an act of faith and a leap into the unknown. So,
how important is spirituality in healing?
well, that's a really good question, because some people don't have a spirituality. And we often use the word spirituality as kind of like religion light. It's like, that's basically what we're talking about, is someone's religious views. And so again, I would respect everybody's, but I think we all make meaning in some way or other. The people that maybe seem to do better are the ones who have a reason. Like, I would love to see a study of people who come off of their psych drugs because they want to get pregnant and have children. Because I think it's easier. I think it's easier if you have because being a mom is a super strong instinctual motivation. It's a pretty strong, I mean, there's a huge drive there. And if you can link up the meaning motivation of something like coming off of drugs, then I think it's so, I mean, it's not a direct answer to the spirituality piece, but it's related, because if you have a reason to be off the drugs, more than just I hate these drugs, but I want to get off these drugs so I can reconnect with my creativity and get back to my music, or I can, then that I think is going to, and often people make meaning through spirituality. Also, there's a moment where you feel out of control and you don't know what to do. And that's the moment of prayer. That's the moment of faith. That's the dark night of the soul. If people can have something that gives them some sense of there's something beyond me, there's something carrying me. Sometimes it really is an ancestor. If someone says, oh, my mom and my dad, they never understood me, but every time I visited my grandmother, oh my God, I miss her so much. That's kind of like a spiritual, like I would say, well, what would your grandmother say right now? You feel like you have no options, you're out of control, everything is screwed, things are getting worse, the tapering is going terribly. What would your grandmother say right now? She would say, keep going. To me, that's a spiritual, she would believe in me. So I think that there's because I'm trained with Jungian psychology, I mean, spirituality and religion are really kind of expressions of something deeper, which is a sense of community and connectedness and belonging in the whole fabric of life, that we have meaning and we have purpose to be here, and it all makes sense. And I think we all have that in us. I sometimes find it through dreams. Like the person will find like, wow, I keep someone I'm thinking I work with, and she keeps like having these very powerful animals. Like there's a tiger in the basement, and there's a little kitten in the basement too. And I'm like, oh, that's interesting. And then, connecting with that tiger, connecting with that part of herself that's maybe, growing out of being a kitty cat and becoming a. So I would come back. I would never impose spirituality on a person, but I think it's terrible that we have a psychiatric profession that thinks the answers are in science and does not recognize that every study that's ever been done, people who have strong religious beliefs, it has a positive mental health overall. Certainly you can get into problems with religious abuse and cult and these kinds of things, but having meaning in your life, volunteering, being able to contribute, being an activist, having a purpose, having a role, all that to me is the spiritual dimension of life. Something is bigger than me, and I have a place in it.
Thank you. You have mentioned the guide of how to taper, and it's available on your website. So until we translate it into Polish, which I hope will happen soon, where can we find more of your work?
Yes, well, my website is willhall.net, and the page willhall.net coming off meds has the guide. You can download it for free. I also host a podcast, madnessradio.net, which is all on the different streaming services. And I have a book, Outside Mental Health, which is at outsidementalhealth.com. You can get it through bookstores. And you can also download a free ebook from outsidementalhealth.com. So those are some ways to get in touch with me and find out more about my work.
We will link all the sites that you mentioned in the description of the video. Thank you very much, Will. It's getting dark here in Poland, but you're on Pacific time, so your day is just beginning.
Yes, it's almost noon here.
So have a great day, and thank you so much for being here with us tonight.
Yeah, thank you so much.
This morning.
Yes, thank you so much for the invitation. Thanks for everybody for joining us. So thank you.
Thank you so much. Thank you. Bye.